everyone. My name is Dr. Naveen Poonai. I'm a associate professor at Western University, and I'm here to talk to you guys today about the role of POCUS in fracture management. Here are the goals and objectives of this talk. We're mainly going to be, going over the probe, how to acquire the images. We're going to go into normal anatomy, and then we're going to delve into abnormal findings, and then I'll go through some pearls and pitfalls and an illustrative case. So POCUS can be used for a vast number of indications for fracture management. These are just a few of them. Stress fractures, supracondylar fractures, which are specific to pediatrics, of course. Buccal fractures or torus fractures, skull fractures, and my personal favorite, distal radius fractures. So the important part about POCUS is that for fractures is that you need to use a linear transducer. Why? Because it has good cortical resolution. It generally has a depth of anywhere from 1 to 3 centimeters, sometimes even more. You're mainly going to be acquiring images in the longitudinal axis with your probe marker pointing distally. You're going to slide the probe medially and laterally because you want to optimize the view. How do you know when you have an optimized view? It's when your cortex is the thinnest. You want a nice, crisp bone cortex. You're going to scan in the proximal or distal direction from normal to abnormal. And you also need to remember to image the lateral, dorsal, and ventral sides. And a fracture is identified very simply by a discontinuity of the cortex. So let's have a look here at this fracture. We can see here that this is the normal anatomy. We can see the physis coming into view here on your left, the epiphysis, and the metaphysis and the diaphysis. Now let's look at some abnormal findings. We can see here that there's a discontinuity of the cortex right here and right here. So what this is here is a hematoma, and above it we can see some soft tissue swelling. There are some pearls and pitfalls to be aware of. The physis, which is again very specific to pediatrics, it can resemble a fracture. So you need to know where your physes are and what's normal and abnormal for the age range that you're dealing with. Lister's tubercle, which can be seen in older children, it can mimic a buccal fracture. It can look a little bit like a buccal fracture. And inadvertently allowing the probe to slide medially or laterally can also easily cause a loss of view and reduce sensitivity. And fractures can actually be harder to see if there's no displacement or angulation. So let's look at a case. This is a 3-year-old male. He fell on the ice and is complaining of pain to his left wrist. Mom is pregnant and wants to avoid an x-ray if possible. I can't say that I blame her. So on physical, his vital signs are stable. He's got some mild swelling and tenderness to the distal radius, and peripheral pulses are strong. Motor function of the hand is intact, and of course this is a closed injury. So the differential here, before you can put the probe on the patient, soft tissue injury without a fracture of the distal radius, and this can either be displaced, undisplaced, or it could even be a buccal fracture or a torus fracture. And what we can see here is we can see that we've performed a POCUS evaluation, and we can see here just coming into view is this. It's actually a buccal fracture of the dorsal aspect of the distal radius. Right here, you'll see the physis coming into view, and there's the buccal fracture right there. I'm going to play that clip for you again. So the buccal fracture was diagnosed, the x-ray was avoided, and a removable splint was placed. So, summary has some key take it to work points. POCUS for distal radius fractures. Easy to learn and can visualize injuries that are easily missed by x-rays. And a comprehensive physical exam should be performed to better localize the site of injury before putting the probe on the patient. And a crisp image of the cortex is needed throughout the scan to maximize sensitivity. The best way of doing that is actually holding the probe as close as you can to the skin, as opposed to near the cord, where you may hold it for some other types of imaging. And if in doubt, image the contralateral side. With that, I want to thank everybody, and I hope you enjoyed my presentation.